I think the reality is that we have the most amazing health care in the world, to be honest. And our foreign doctors that work here, who come from countries where on paper it says that the outcomes are better than they are in the U.S., would tell you that if their family members get sick, they're bringing them here. We have more stuff, more capabilities, more research and such than most of the countries in the world, but we don't have access for everyone. And in the bulk of competitive countries with us on healthcare outcomes, they have coverage for everyone. And whether that comes through the private sector or through government, that access allows everyone to get into the system sooner. I think we also have more access than most countries in the world, and access means availability, and so I think people use that more. I think that, when we have symptoms, we check into them quicker. And I think the other side of access is that people that are uninsured or have less insurance perhaps than they feel comfortable with wait on things, and oftentimes things that could have been dealt with fairly simply earlier on are overwhelmingly challenging and require a tremendous amount of resources. Technology has driven our costs up quite a lot. It's a very complicated subject because of the things that we can learn from CAT scans and MRI scans, which are very expensive compared to traditional x-rays. Oftentimes we can avoid surgeries and such that were done in the past. So from a cost standpoint, in the long run it's cheaper, perhaps, but having the technology means that it gets used quite regularly to rule out things. Well, the most expense, honestly, is pharmaceuticals, and primarily in oncology drugs. There are many oncology drugs that are $10,000 and $20,000 and $30,000 per month, and when you consider that treatments can be months to years, that can be an overwhelming number. Many times our inability to be there early with chronic conditions like diabetes or such result in significant illness later on, or much more developed problems that require much greater attention, and that may require surgical interventions, it may require more pharmaceuticals and such, and all of those things have significant cost. Well, the most expense, honestly, is pharmaceuticals, and primarily in oncology drugs. There are many oncology drugs that are $10,000 and $20,000 and $30,000 per month, and when you consider that treatments can be months to years, that can be an overwhelming number. I think many times our inability to be there early with chronic conditions like diabetes or such result in, one of the challenges was that we knew when the healthcare exchange came out and we were able to insure a lot of people that hadn't been insured previously, that there would be pent-up demand. The government had promised us that, knowing there would be pent-up demand, that they would actually reimburse us for what would be considered that the costs of that pent-up items that needed to be dealt with. Congress came back later and said, we can only afford to pay 12% of that. And so that meant for the Avera group that it cost us over $30 million that we were not reimbursed by taking care of folks that under that plan. United Healthcare, it cost $700 million that they lost because of that. So in some ways the government didn't live up to this transition time. We felt that once we got through the transition time that actually it could work quite well. It's frightening when you think about having a $10,000 deductible on your insurance plan if you make $12,000 a year. That might as well be $1 million to them at that point. So I do think that giving people comfort that they can get into primary care early and get address needs, address chronic conditions in a way that avoids the travesties that happen downstream that require hospitalizations or surgery or amazing medications, would be very helpful. As an example, a single mom with 2 or 3 children that works 2 or 3 jobs just to get by, but all part-time, so she doesn't get coverage from any of her workplaces. That puts her in a really tough spot. She may make enough money not to qualify for some of the support mechanisms, although she deserves to be supported with all of the work that she's doing to make her family work. So I think that we can do that better, but maybe that's more of a tweak than it is a total upheaval of what we're having today. Without that, we are going to have people on the outside, and at some point they will cost significant amounts of dollars just to care for their tragedies or travesties, as opposed to getting in early in the front line and being able to help them with issues before they develop into something bad.